They ask me this question all the time and they say to me, but Dr. Kennedy, this one feels so real. And I actually don't let them get away with it. Even though that I know they know what it means, every time I stop and I say, no, all symptoms are real. If you're having a
Yeah.
symptom, it's real because all symptoms are created by neural circuits in our brain. That's just how symptoms are made. That's how we
Yeah.
experience the world.
So many of you tell me how overwhelming it feels, and I know this feeling myself well, when symptoms seem to take over your life: fatigue, brain fog, pain. And yet, the answers from the medical community don't seem to add up. It's confusing and it's frightening, and at times can make you feel like there is no way forward. But here's what I want you to hear: these symptoms are not random, and recovery is possible. I'm Raelan Agle, and if you're new here we uncover practical ways that people get their lives back from ME/CFS, long COVID, and many other chronic symptoms, guided by experience and by evidence. And today I'm excited to be joined by the incredible Dr. Becca Kennedy over in Portland, Oregon. She is a family medicine physician with over 20 years of experience. Dr. Kennedy spent 15 years at Kaiser Permanente, where she grew increasingly frustrated by her lack of options for patients with chronic conditions. And that search led her to train extensively in mind body medicine. She went on to run the long COVID specialty group for Kaiser for the entire Northwest region, working with hundreds of patients. And then in 2023, she launched her own clinic, Resilience Health, to focus entirely on this work. In this interview, Dr. Kennedy will explain the science of how symptoms are generated in the brain and nervous system while still being very real in the body. She shares her own journey with chronic symptoms, how her personal recovery shaped the way she now treats patients, and the common patterns she sees in people who finally break free from this. We're also going to talk about why the language doctors use matters and can at times be damaging. We talk about what's shifting in the medical system right now and the practical steps that you can take to keep working with your physician while pursuing a recovery approach. So, if you've ever wondered, but how do I know if my symptoms are structural or are they neuroplastic coming from my brain? This interview will give you clarity and validation and a whole lot of hope. So, let's dive in. Dr. Kennedy, I am so excited to have you back. Thank you for being here.
Yeah, thanks. It's my pleasure.
So I know we've talked about this before in your last interview, but it's been a while. And I know that also, globally, our understanding of all this, shifts and changes. So I love to take the opportunity whenever I have a guest like yourself with such extensive experience and understanding of what's happening with these conditions that we call, neuroplastic in nature or whatever term we use, where things like nervous system regulation and brain retraining seem to be effective.
Hmm.
But every person explains what's going on here in a unique way. And every time I hear it, it helps me understand it a little bit better. So I'd
Yeah.
love for you to just explain, because it still is a little bit or a lot for us to wrap our heads around. So, what
Yeah.
is happening? Like, how do you help people, patients, understand the science behind what is happening with these conditions?
Mm. And it's so important, right? Because if you don't understand what's happening, then it's really hard to get better.
Yeah.
And there's many pieces of the science that I think are really key. And the science is probably what many people know by now who are watching your channel. But the idea that symptoms like pain or fatigue or nausea, that all symptoms are made in our brain by neural circuits to protect us and to communicate from our unconscious brain to our conscious brain, and that symptoms are not made by the nerves out in our body. And so, if there's structural damage in our body, that can be one of the reasons that our unconscious brain then makes these protective signals. Absolutely. But they can also be made for other reasons of our stresses in life or our unconscious brain perceiving psychological threats. I mean, that's a reason that these symptoms can be made. The symptoms can also be made because of the structural damage in our body, but then after our body heals, they get stuck in place. So there's lots of different reasons for the symptoms to be created, but they're created in our brain as warning signals. The other piece of science is this whole idea that our brain is a prediction machine, that our experience for us is made in our brain by our neural circuits, and our expectations and our predictions is a large part of that. And then the other piece of science that's really helpful for me is a conditioned learn response, and that our brain is making meaning out of these stimuli from the world all of the time. And then again, our unconscious brain is automatically and reflexively now creating our experience for us. But really, it's all about the brain. So those pieces of science, I think, are really helpful as we think about it. That the symptoms is about protection and warning, keeping us safe. But I think that people can get really understandably confused because I think that sometimes when we talk about it like mind body or brain body, it can be very kind of what we call dualistic. And so it's all just the neural circuits in your brain, your body's not damaged. And sometimes we talk about that, this isn't a structural issue, you're
Hmm.
healthy, you're safe, all of that. But it's really confusing, right? Because often
Yeah.
there's symptoms that you see in your body, rashes, swelling, and you're certainly
Hmm.
experiencing it and feeling it in your body. And so it's just
Yeah.
so confusing
Yeah.
to wrap your brain around, right?
Oh, I feel like you were just quoting me. I'm like, I'm doing my fair share to confuse people out there.
Yeah.
Oh,
And I do think that those ideas are helpful. Like, I mean, those ideas
yeah.
are important. And so the way that I think that if we kind of bring it down a little bit more is that so what we're looking for is what's the generator of the symptom and where's the solution for the symptom. And
Yeah.
so like what I had chronic pain and fatigue after I learned about this approach because my brain was trapped and I had big stressors and this is about our unconscious brain, not about our conscious brain. And my particular brain also sends the signal of inflammation, and not everybody's brain does that. And so
Mhm.
these chronic symptoms are not necessarily just about inflammation for everybody, but the inflammatory signal is a protective signal. Like if we break our hand, our brain also sends a signal to for inflammation in order to protect that injury. So for me, I had the signal of inflammation. So I could see swelling in my body.
Yeah.
You could see it from across the room. And so again, it's our brain and our body is constantly sending signals. I mean, every second of every day, down and back up and down and back up. So it's not just like we have this brain and mind up here and then this body down here. I mean, it's just constantly this ongoing flow of communication. So
Oh,
the inflammatory cells, like the inflammation in my body, is also sending information to my brain. And then my brain is responding to this information and saying, oh, inflammation down here. Ooh, that's bad. That's danger. So part of the pain that I experienced was also probably because of a structural change in my body. But the generator of that structural change was my brain. It was my brain perceiving I was in danger because of actually these psychological things going on in my body. And now that was part of the loop stuck in place.
I love this so much, and this is why I ask this because every person explains it in a different way, and in a better way than everybody else in their own way. And I just keep having this image of these people watching the videos going, "What do you mean there's nothing structurally wrong with my body? I can see it."
Yeah, right. Yeah, exactly. Exactly. Yeah.
I think the point me, to come to the reason I explain it that way, and from this moving forward, I'm going to explain it differently, is that so many people feel that their body is broken. Right? They
Yeah.
feel the symptoms are so intense that they think they're having some kind of multi-organ shutdown. That many people think that they're
Yes.
dying.
Right.
So the message I think many of us are trying to really get out there is that it's not that your body is broken, so broken that you can't get better. It's coming from the brain. But
Yeah.
yeah, without really explaining how that all works and how that actually translates into
Hmm.
observable physical symptoms, it's
Hmm.
just, yeah, one more layer of confusion for all of these poor people trying to sort out what on earth.
Yeah. Yeah. Oh my God.
Yeah.
Right. It's not easy
Yeah.
to understand for sure.
Yeah. So can you share? a bit about your own personal journey? Like, I think, or not, I think, I know you've had your own experiences with chronic symptoms,
Mhm.
and I suspect this influenced your path to what you do now. So,
Yeah,
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 tell us about that.
absolutely, for sure. Well, I came to this work actually because of my patients and being a primary care doctor and just seeing patient after patient every single day for years that we couldn't help and I couldn't understand.
Yeah.
And so I searched for years and years and years, and I was fortunate enough to come upon this approach. And it was when I was working at Kaiser, and I was working in an integrative clinic, and so I was starting to, see people in that clinic and talk to them about this, and then seeing that, oh gosh, wow, there's really a lot here, and a lot of people were saying to me, actually, wow, this is the first thing a doctor said to me that actually makes sense, and really seeing a lot of improvement, and that this was a really important path. um, but again, it was being trapped in a lot of different ways, and kind of saying this information that a lot of people around me weren't believing, but yet I couldn't unsee it and I couldn't stop doing it because I saw so many people getting better, and that this was really the only pathway to their wellness after trying everything. So it was sort of a situation of, um, again, feeling trapped in the situation. A few patients got really, really angry at me. And as a people pleaser myself, it really cut to my core. And it was really surprising how few people got angry at me, frankly. I mean, not that I was, I obviously was like very compassionate and kind, I
Yeah.
think. But
Yeah.
just it's hard information, and people have
Yeah.
been gaslit, and I get that. Um, but that was going on. There was a very, very big stressor personally in my life with a friend. And there was just all of these things compounded all together. And then I developed pain in my knee, and I'd had my ACL replaced twice, but it had been 20 years, and my knee was fine. I skied and I ran and all that stuff. So when I started getting pain in my knee, I actually, because I had just learned about all this work, I knew right away that this was my brain. So I was actually literally reading Howard Schubner's book, Unlearn Your Pain. And I had had pain in my knee that started just a few days before this. And I thought, oh my gosh, oh, wait, this is what's going on my knee. Because I didn't actually
Yeah.
injure it, I could
Hmm.
run on it, but it hurt afterwards. And so I was walking down the stairs and I thought to myself, actually, what we were talking about at the beginning, I'm healthy, my knee is fine, I'm not
Yeah.
broken. And I was able to get my pain to go away like that, like within minutes even.
Yeah.
And I thought, oh gosh, wow, this is really amazing. But it was actually after that that many more stressors came into place over many, many months. And it was actually as I was diving into this work. So the symptoms came back, but then they really built and grew. And I knew that they were neuroplastic or mind body the whole time. But they built and I grew, and I was really stuck in these deep stresses in my life. And I was just working on all of these things myself. And so little by little, I mean, I it would change a little bit, it'd go all over my body. My symptoms were really, really bad at night. I mean, I had like burning pain over my whole entire body. Like I could barely sit up at night. It was really bad. I was quite fatigued and I could work, but I really couldn't do much else in my life. And the symptoms came and went a little bit, but they're pretty severe. And I had symptoms for actually 2 years while I worked on all of this. And again, there's times that they were better and I could function fairly well. And so they were quite bad for maybe like 6 months or something like that. But they really hung on for quite a long time. And it was really, really helpful for me to have gone through this because now I'm such a better clinician, and I'm so much better able to help people going
Yeah.
through this because I have experienced it in my own body.
Yeah, it's interesting, and I mean, I've been through my own CFS journey, and I think of that as being behind me, but we know that the brain and nervous system can create any and all sorts of symptoms
Mm.
for all sorts of reasons, and I know that symptoms still come up. It just looks different. I had all of a sudden, waking up with debilitating back pain. Like, I know
Yeah.
what's going on here.
Mhm.
But yeah, yeah. And every time that comes up, it helps me as well to remember and get that empathy of what it's like to work through it. And
Mhm.
yeah.
Yeah.
Thankfully, the research on this continues to build, and our understanding of mind body conditions continues to evolve. And
Mhm.
this is something that we've been talking about for, well, some people have been talking about it for decades, but
Mhm.
becoming more mainstream in the last
Mhm.
few years. But I'm curious. I'd love to know what are some of the things, the most recent things that you've learned about treatment? Are there things that have changed in the last year or so of doing this work that are new, or maybe even contradict some of the things that we used to think were true with mind body conditions?
Oh, interesting. I mean, I guess in my own pathway, I definitely build and grow and make it more full and rich as I go through time. I don't know that I would necessarily think of it as contradicting anything per se. I think that there's definitely more people out there, doing more and more things. I guess the way that I think about it and the things that I find the most useful is I think there is that sort of understanding the generator. So, is the generator of the symptoms our brain and the neural circuits stuck in place that then is creating the symptoms or some changes in our body? Or is it some sort of structural damage in the body? So I still think that thinking about it like that is still helpful. And is there something in our body that needs to be treated? Broken bone, a bacterial infection, or something like that. And we treat that in a certain way, or is it the neural circuits? But the other thing I think is really important, and well, actually, going back to that piece, is that sometimes for some people, really what they need to break is just the symptom kind of fear or the threat symptom loop. And for some
Yeah.
people, that's all they need, actually. But for many people, it's really understanding how we work as a human and understanding our survival brain. And what does our survival brain, what has it learned, or what have we evolved over millions of years to find safety? And generally, it's other humans. That's what brings a human survival brain safety. So it's the connection with other humans or the lack of connection and what our brain learned about that connection as a child, what we deserve as connections, and what, the safety that our life brings us, and what our behavior brings, or how our behavior brings us safety. So if we've learned personality traits that, like, all of which I have, of being high achieving and being hard on ourselves and needing to be perfect or control or being a people pleaser, is really that's all about the survival brain. And our brain learned that that's how we connect with other humans. So again, understanding from our survival brain that what means safety and what means
Yeah.
danger, and why our brain would be responding the way it's responding in the moment as if we're in danger. And I found that those pieces are so helpful because otherwise, if we don't understand what is our brain trying to protect us from, then it's really hard to get to the root. And often, what our brain is trying to protect us from are things like conflict and difficult conversations. And we're saying yes to everything and putting ourselves on the back burner. We're not experiencing joy, or people are treating us in a way we don't deserve. And we have these emotions that we're not expressing, we're not standing up for ourselves. A lot of what I
Yeah.
do with people is teach them healthy communication and boundary setting and learning self agency. And so, again, learning how all of the pieces fit together, I think, is really key to all of this.
Yeah, and what I'm seeing in the people that I interview is that not all the pieces apply to everybody. So sometimes people
Yeah,
are watching or
right,
focusing on
right.
certain pieces that other people say are very important, and it doesn't seem to
Yeah,
be
right.
delivering them where they're trying to get, whereas other people, so yeah, there's many different understandings of this, and everyone's journey,
Yeah,
even if it is a mind body condition that's happening, your path out of it is going to look slightly different than
yeah,
the recovery interview you're watching right now, because it's,
yeah.
yeah, that what the brain is interpreting, what their brain is interpreting as threats and
Mhm.
safety is different than what's happening with yours.
Yeah,
I'm
right.
thinking,
Absolutely.
I interviewed someone recently. Their daughter was diagnosed with ME/CFS at 7 years old, and then really quite severe. And she recovered when she was 10 using brain retraining and mind body
Oh,
techniques. And there was no she's a happy, energetic child in a good home, and there was no
yeah,
unpacking childhood trauma or, it was, so
exactly.
everyone's
Mhm.
sometimes the brain is stuck, in a
Yep,
threat assessment. And
yep,
so yeah,
mhm,
lots of
yep,
different things that are going on here.
mhm. Yeah, exactly. Right.
I'd love to hear, because you said, sometimes patients get mad at you, and, because when I interview physicians from around the world, they have different experiences in different countries. And in some places, doctors have to be quite careful because patients can file complaints when you're saying things that other doctors
Yeah.
aren't saying.
Mhm.
So, but I know you've been here practicing this way for some time. So,
Yeah.
what is your experience, from the other side of us laymen's, in the medical world, from your colleagues? Is this becoming more accepted? Is it becoming more mainstream? Is it something you have to tiptoe around?
Kinda all of that.
Okay.
mean, I think it's a little bit more accepted for sure. I mean,
Mm,
I think that there's definitely a wave coming in. I think a lot of doctors and clinicians understand this and have experienced this. And like before I knew about this approach and what led me to this approach is really just seeing the pattern of often people did have a lot of stress or people did have
mm,
childhood trauma, although absolutely, like you're saying, it's not necessary for sure. And this is really about being a human being, frankly, just straight up. But seeing this pattern and seeing then the symptoms didn't follow physiologically or over time, especially being a family medicine doctor, I would see these sort of symptoms in sort of the same person, but change over time. So I think we all experience that it makes sense, but we don't have the pieces of science to really understand it. So I think what doctors say often are is language that isn't necessarily that helpful. Like what I used to say would be things like, well, your body is fine. I think that this is just stress. Not so helpful, right? I mean, number
yeah.
one, to put just in there when someone has overwhelming, debilitating symptoms, completely
Yeah.
ruining their life, right? Or saying things like, oh, well, this is anxiety and depression, go see mental health. Well, it's not exactly anxiety and depression. And what I found is that anxiety and depression neither causes the symptoms, nor do the symptoms cause anxiety and depression, but rather I view them learned from Dr. Schubiner, and this is how I've seen it play out, is that the anxiety and depression are actually just other symptoms. Like it's just another arm of the beast. So if we're now telling someone that you need to just treat your anxiety and depression and then your symptoms will go away,
Right.
well, that's not actually how it works. And then that poor person is just trying really, really hard and taking the medicines the psychiatrist tells them to take or doing all of these things, but it's not quite the right path. And then they can feel frustrated and hard on themselves and mad at their doctor, and it's just problematic. So I think that what's really important and what I've found is that really finding better language and really being able to describe it that, hey, your symptoms are absolutely real. And this is happening from your brain. This is new neuroscience. And now we understand it. But I think really, really, really the first thing for a doctor to say to a patient is actually to listen. And I think that's just so key of really, really making sure that someone is really fully heard and listened to and believed and all of that is so key. And back to the medical system, it's just sort of a tragedy of where the medical system is at this current point in time is that no one has that time
Yeah.
in particular. And so it's really hard to be able to give that space and that time and really be able to sit with someone and hear their story and kind of put all the pieces together. So, again, I think that there's more clinicians that are open to this. I think in general it makes sense to a lot of people, but they just don't have the enough of the science in order
Yeah.
to have it make full sense. but
Yeah.
hopefully it's coming.
Well, I love that you are out there and other people like yourself sharing this information. It's got to be more more credible coming from doctors. I'm just thinking, I every time in my life somebody asks me about this. I was at a doctor's appointment this week, and the doctor's like, "Oh, what do you do?" I have a YouTube channel. What's it about? And I tell her, and she's like, "Oh, how are people recovering?" And I just like, oh boy, I'm gonna sound like some crazy
Yes,
YouTuber too, spreading woo woo.
I know, right.
And I'm making a lot of assumptions that might not be what people are taking away from it, but yeah, it's a challenging thing. You never really know where people's level of understanding is on this when you dive into these conversations.
Yeah, right. And I've been surprised when I say I have the same experience and at a soccer game or something talking to another parent. And every
Yeah.
now and then someone will say, "Oh
Hmm.
yeah, no, I actually think that
Yep.
makes perfect sense."
Yeah. Oh yeah. They'll be like, "Have you read, Dr.
Yeah,
Sarno's book?" And
yeah,
I'm like, "What?"
yeah, yeah,
Yeah. So it is shifting. It
yeah.
absolutely is. For people who are working with their doctor and maybe their doctor isn't as up to speed on this particular, because doctor, we think of doctors of should know everything about absolutely everything, but obviously can't keep up on every area of research. So
Yeah.
if people are going through this and they have a doctor that they like and they trust, but they may not be completely up to speed on this, like, do you have recommendations for how to keep working with that doctor while also going on this path of potentially doing this mind body work?
Oh gosh, it can be a challenge. I mean,
Yeah.
can be a big challenge. And I think it's really important to work with the doctor and, certainly people need to be
Mm.
fully assessed and also not over assessed as well, which unfortunately often happens, and where that sort of sweet spot is, can be a
Yeah.
challenge and really, really scary and frustrating from a patient perspective, especially if you're not working with someone that understands this or that can it can be frustrating. What I recommend to people is, well, number one, to work with their GP, I think, or primary care doctor. I think often primary care doctors see the whole picture of people, a little bit. Well, that's just their day-to-day work every
Mm.
day. And so sometimes, yeah, I mean, you can certainly sort of explain it to the doctor and say, I'm doing this neuroplastic work or mind body and, kind of see what they think. But I think another way to say it, even sort of back to the doctor, is say something even like, I think that these symptoms might be stress, because that's sort of the words that the doctors understand. I just
Mhm.
wanna make sure that there's nothing scary or bad or concerning wrong with
Yeah.
me. I'd like to work with you for you to assess me to make sure that you're not concerned about anything else that these symptoms might be. And I think
Yeah.
sometimes for some doctors, if you kind of open up that avenue and give the
Mhm.
doctor an okay to talk about it like that, that can be a way in.
I love that. I really love that. That's incredibly helpful, just knowing the language to use. And so many of us, myself included, just sort of give up on conventional medicine. I didn't want to go to a doctor for years. I just
Yeah.
felt frustrated and to my own detriment because there are things they could have been helping me with.
Yeah.
But I just, yeah, found the whole experience to be more stress than it was worth.
Yeah.
But yeah, it's really important to keep working with the medical system,
Yeah.
but also to do it in a way that's helping you.
Yeah, yeah,
Yeah.
exactly. Yeah, it can be
Yeah.
very, very difficult. I think the other thing is that kind of narrowing it down as much as you can in each appointment to kind of one category or one symptom. And I mean, certainly we can have lots of symptoms, but the more specific you can be for that doctor and really lay out the pattern of what that is, then I think the doctor can, because we're really really good at identifying structural damage in the body. Doctors are
Yeah.
pretty darn good at that, and so if you can really kind of narrow in on what those symptoms are, and have that conversation in that way, it can be helpful. Not always. There's a lot of unfortunate medical trauma out there and many people who have gone
Yeah.
through this.
Yeah. So I know you've worked with hundreds and hundreds of patients in a variety of capacities, and I'm just trying to figure out the best way to tap into all of that. Like what we talk about this being for many people a mind-body condition. The brain is creating these symptoms, but what does that actually mean for the patients and the people that you work with? What does recovery look like? How do you move forward once you have determined that that is likely what's happening?
Well, again, it's really figuring out for that individual person, what is their brain protecting them from? Like, what are the issues for them? And so sometimes people see me, especially because I'm a physician, that they've done all of these really amazing techniques and helped themselves, but they still don't have the belief 100% that this isn't structural, some sort of structural problem in the body. And so sometimes that's all I need to do is to really allow them to see that. And really, I bring in information, I bring in the science and really explain it so in a way that they can understand. And so for some people, that's all they need is to break that sort of threat symptom loop. But for many, many other people, it's again really looking at what is going on for them in their life and what did their brain learn that keeps them
Mhm.
safe. And so understanding the different pieces that they need. And so sometimes it is just kind of calming their nervous system and doing some tools to do that part of it. But much of the time, I would say I really dive a little deeper down into what our brain learned from our childhood that is stuck in place. And again, many, many times, people haven't had childhood trauma. They had nice, loving parents. There's lots and lots of different reasons for our human brain to be learning these maladaptive ways to protect ourselves. And so it's looking into what what's going on for us in our life and why our brain is responding in that way. And again, sometimes it's because we're feeling trapped. We're saying yes to everything and we're putting our own needs on the back burner. And we need to learn how to stand up for ourselves or how to say no, how to have different communication. Sometimes it is because of repressed emotions. I use emotional awareness and expression therapy, and I think it's an amazing, amazing tool. And often it is helping people express emotions. I myself didn't. I learned not to express my emotions throughout my life, and so that was a big piece for me. It also is a really helpful tool to go back in time when our brains learned whatever it learned in order to rewrite that memory so that our brain is now perceiving what we went through actually through our adult rational brain's perspective rather than through our child's brain's perspective. And so it's rolling in those different parts. Another really big piece of the work that I do with people is often our brain has learned a false negative core belief that we're not unconditionally lovable and worthy. And that's unfortunately very, 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 very common. It's what my brain learned. It's what many of my patients' brains learned. And it's away from our conscious awareness. And so our brain, our unconscious brain both believes this to be true in in an unconscious way, but also that sort of quote unquote truth is too painful. So our brain also covers it up. And it covers it up by things like overachieving or being productive or saying yes to everything. And then again, we're sort of trapped. And so a lot of what I do is this really heartfelt work, especially with the EAT, of really teaching people's unconscious brain that they are actually unconditionally worthy and lovable. And it's really beautiful work and it's really amazing and it's really enjoyable to see people go through this sort of transformation.
Yeah, I love how you just explained and highlighted some of the ways that people's brains can get to this state because so many people don't relate to that story of, trauma or stress, but
Yeah.
there's so many things that can get your brain perceiving danger in this way. And it can be competitive sports. It can be, I think about in my 20s where I had assessed, or I've determined the society was telling me if I was even 10 pounds overweight, I wasn't valuable as a human. So 1,000 times a day thinking about what I ate, and every time I saw a mirror, like there are so many things that can put you in a state of
Yeah.
feeling that way, not safe, not worthy, unless.
Mhm.
So yeah, unpacking that is,
Mhm.
yeah,
Yeah.
yeah,
And I find that often the last piece for people sometimes, because often I see people who have tried all these different things and, they're still not better, kind of trying to find these missing pieces. And again, it can be different for everybody, but very typically a missing piece. And this was the missing piece for me. This is what took me a long time to get to. And I had these symptoms that were just hanging on and hanging on and hanging on. And it really was that internally being hard on myself.
yeah,
And I just see that so often. And it's just even, it's not even in our conscious awareness, but it's just this sort of 24/7 kind of being hard on ourselves and we need to do more and we're not doing enough. And just this, this chatter that's just going on all the time. And really getting over to the place of I'm doing my best and my
yeah.
best actually is enough. And really seeing ourselves and other people through the lens just of humanity. And it's not easy being a human on this planet. And we are all doing our best trying to figure out this crazy world. And when we can really truly come to ourselves with self compassion and deep love for ourselves and let go of kind of this pressure, I think can really be transformative.
I'm just thinking of the message that, and it's a helpful one that we've all been hearing for years, of highlighting this narrative in our head that says, I'll be happy when, right? We
Oh,
find that people are
mhm,
constantly waiting for something else, but you
mhm,
can shift that
mhm.
to I'll be enough when, I'll be safe
Yeah.
when.
Mhm,
My grades are perfect. I'm the best athlete. I'm in perfect shape. I have the nicest
mhm.
home. I have
Yeah.
2 degrees, 3 degrees. I have the best
Mhm,
career, the nicest car on the block. It's,
mhm,
we think of it in terms of happiness, but for many of us, it's like, I'm not okay. I'm not enough.
yeah.
I can't rest until I get that next thing. And then you get that next thing and you feel okay for a minute. And then
Mhm.
it's something else.
Yeah, right,
Yeah.
exactly. Yeah, and I
Yeah.
think a lot of that comes from, again, if we think about our survival brain and other humans is what keeps us safe, is protects us, is what did we learn about how we get that connection? And sometimes there can absolutely be, egregious abuse from our parents. And,
Yeah.
certainly that's what their brain learned that they were not deserving. But it can also be very loving, kind parents that are able to emotionally attach. But maybe they wanted their child to make sure they succeed in their world. And so they were, had these high expectations, and maybe they showed their love more often when they got good grades or they were a good girl or whatever it was. And so, again, their survival brain learned to associate and learned to attach this achievement in sports or school or religion or whatever it was with now getting our attachment from our caregivers, who's the people that keep us alive on this planet. And then our brain learns these things as a child and takes it through our life. And again, this is our unconscious brain, the danger part of our brain that has learned these messages and is just automatically, reflexively responding. And this is not the part of our brain that is the conscious, rational, logical part of our brain. But this is the part of our brain that gives us our felt experience. And our felt experience is actually what's true for us. Just our cognitive thoughts are not necessarily just the truth for us. It's how we feel. And because how we feel is created by our unconscious brain, where the danger part of our brain is, there can be such a disconnect. And I think really reconciling that sort of disconnection and really understanding these two parts of how our brain works is really key, is that we need to feel in our unconscious brain and our felt experience that we're safe and that we're unconditionally lovable and we matter and all of that part.
The $1,000,000 question here, from what I see of all the people who reach out to me and DM me and put comments on videos and posts,
Yeah.
is that it seems like in our community of people who are facing these conditions, there seems to be a divide where we think either this does apply to people or it doesn't. And they're trying to figure out which camp they are.
Oh,
And a lot of frustration from people saying, I'm
mhm.
so tired of hearing about this nervous system stuff. This
Yeah.
has nothing to do with most of us.
Oh,
So,
yeah.
how many people does this apply to?
Oh my gosh.
Who does this apply to?
This is the $1,000,000 question. This applies to every human on the planet. I mean, just point blank. Some
Yeah.
humans have chronic symptoms that stay in place for a very long time and are overwhelming and debilitating and take them out of their life. But every human has had a symptom where their body is not damaged and their brain is creating the warning signal. Every
Mhm.
single human, whatever it is, blushing, having a tension headache at the end of a long day, getting up in front of your third grade class to give your presentation and you have butterflies in your stomach. So that's all this is. I mean, everybody
Yeah.
has experienced it. It's again just the question of the chronic ongoing symptoms. What is the generator of those symptoms?
Do you find cases where there are people where doing this work is important, but there are also structural issues that need to be addressed in tandem as they work through conditions like long COVID or ME/CFS?
Well, certainly. I mean, our body also does have structural,
Yeah.
problems that we can have. Absolutely. I think that it's really important to look at each individual case. From my perspective, in terms of long COVID or MECFS, is that is fully about the brain and the nervous system sending the signals. Yes, there can be swelling or rashes, or
Yeah.
like with me, I had really tight muscles and weakness. Like I actually couldn't really use my upper body very well. I couldn't actually get off the floor by pushing myself off. And so, but again, the generator was because of my brain stuck in the fear mode and having learned these neural circuits that were stuck in place. And so, again, I think it's really important to look at all of the different or each individual person. I do think that many, many, many symptoms are very commonly more the brain stuck in place, and I think it's more often the brain and the nervous system signaling than structural a lot of the time. So if people have diagnoses like irritable bowel syndrome or fibromyalgia or chronic fatigue syndrome or long COVID, migraines, tension headaches, is that is neuroplastic. That is the signals created, the neural circuits created in the brain that are stuck on loop. But there can be certainly other things that there can be something structural in the body, that there can be sort of a two-way street. I think autoimmune disorders is something that's more like that. There is some evidence. Some people who have resolved their autoimmune disorders completely doing the sort of brain and nervous system work. But I think something like that is a little bit more of a two-way street.
Okay, so that all makes a lot of sense. I'm thinking about, every day I hear questions from people online, even in my own, brain retraining recovery program, virtually every day. Like, okay, but I'm still confused. So today I woke up with this one symptom. So how do I know if this is part of the ME/CFS or the long COVID? Is this a neuroplastic mind body thing?
Mhm.
Or how do I know? Is this something else that I should be worried about or seeing a doctor about? Is this something different? So yeah, how do
Mhm.
people distinguish or
Mhm.
figure out what's happening there?
Yeah, well, so much there. And a lot of times people, I mean, they ask me this question all the time and they say to me, but Dr. Kennedy, this one feels so real. And even after
Yeah.
people know all about this, they'll say, or they'll say to me, no, 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 this is actually real. And I actually don't let them get away with it. Even though that I know they know what it means. But I every time I stop and I say, no, all symptoms are real. If you're having a
Yeah.
symptom, it's real because all symptoms are created by neural circuits in our brain. That's just how symptoms are made. That's how we
Yeah.
experience the world. So
Yeah. They're all
now,
the same.
yeah, so
Yeah.
now what you mean
Yeah.
is the generator of it because of something structural that I need to attend to in one way, or is
Mhm.
it the neural circuit that is it the warning signal that's stuck in place that I don't need?
Yeah.
So I think again, I think it's so important to understand that our felt experience created in our unconscious brain is the same, whether it's generated by structural damage or just the neural circuit stuck in place. In terms of how do you figure out, especially if you have a new symptom, yeah, it can be hard. And number one, I want people to know that when I have a new symptom, my brain automatically looks into my body. Like my brain automatically responds with, oh, what did I do to my body? Oh, what's wrong with my body? Because we have evolved, our brain has evolved to connect up symptoms in our body with some sort of damage in our body. That is why we have the symptoms. And so that is normal and it's okay. And but then after that, it's then sort of then taking the second stab at it and saying, okay, well, why is the symptom here? And so I think really going through, well, did I injure myself? So if it's like out where our arms and our legs and we don't have like internal organs, did I injure myself? Did I injure my muscle or my bone or my tendon? Is there some sort of external force on that part of my body? And if not, then less likely to be structural damage. Is there an infection? Like, is it red and swollen? Something that I can
Mhm.
see that's infected. Or if it's, some other part of my body, like my internal organs, is there something that could, be going on there? And as a patient, you don't necessarily know because you're not a doctor. um, so I think the other part is to, give it a little bit of time, even
Mhm.
a couple of hours, and maybe even do something that's sort of relaxing or grounding and just notice if it shifts a tiny bit. And then also really think about, well, what's going on in my life? And I think it can also be helpful. What was going on? What's going on now? And what's about to happen in my life? And this,
Okay.
I experience this all the time where I think to myself, oh, there's something in my body, this back pain or something. Oh, what's going on in my body? Okay, wait, I didn't do an injury. I didn't injure myself. Okay, well, nothing's going on in my life. I don't know. And then I think, oh, gosh, geez, well, next week I'm actually planning to go do this really stressful thing. Oh, yeah, that is there. And so, again, I think really kind of stepping back and looking at the whole picture to really put the pieces together. And then the next one is, yes, going to the doctor, getting checked out if that needs to happen. I mean, I think that can be an important piece. And I also completely understand because I've had these conversations over and over and over with people that that can be a very stressful, difficult experience, traumatic experience. And sometimes then doctors order tests that aren't helpful. So it is a messy, problematic direction. But I think the best that we can do is kind of looking at all the pieces and then hopefully finding, a trusted medical professional as needed.
Yeah, I love that. And that's very helpful. And I'm thinking of a specific scenario that came up recently where someone asked me, they said, I've been going along well, with my recovery and symptoms have been decreasing, but I woke up this morning and I have a cold. Or I think I have a cold. And it might not even be something that they would seek medical attention for. They're just
Yeah,
confused. So, like, should I rest because it's a cold and I
yeah,
have, this virus, or should I keep going because it's a neuroplastic cold.
yeah,
And,
right.
but that focus of, okay, what's been going on recently? What's
Mhm,
going on right now? What's going on, coming up in the future?
mhm.
Just being a little bit curious and investigating in your life about, is there something that would cause a bit of a symptom flare right now?
Yeah.
And then just, it doesn't hurt to rest
Mhm.
for a couple days and see what happens. Do
Yeah,
I'm sure had a lot of
exactly right.
colds in your life, you know how they progress and you can, yeah,
Mhm.
wait up. Yeah, no, that's
Exactly
very
right. And
helpful.
I think it's so
Yeah.
easy to sort of manage, kind of thinking about and dissecting the symptoms and wait, should I push through it? Should I rest? What should I do? And I think
Yeah.
also it's really just the bird's eye view. It's a process, it's over time. And whether you decide to rest or you decide to push through in that moment, it actually doesn't really matter. It's really
Yeah.
the overall process and over time that gets us there.
Yeah, absolutely. This is absolutely incredible, Dr. Becca Kennedy. I really appreciate you being here. Of course, we'll have all your links in the video description for people who want to learn more about you. And I just love this so much. I'm going to link here. I have a playlist now just of medical doctors
Oh,
talking
good.
about recovery from these conditions. So
Yeah.
I know not everyone can find their way into your office necessarily, although they can get a lot of resources from you and help.
Yeah.
But now we can bring people like like yourself and deliver you all over the world. Oh, so really incredible. Thank you for this today. So informative. I've learned so much. You explain things so incredibly well. I just really appreciate you. Thank you, Dr. Kennedy.
Yeah, you're welcome. My pleasure being here. And thank you for all the stories that you're getting out. It's really important.
Oh, it's amazing. Recoveries, I can't keep up.
I
There's
know.
so many.
I know. It's
It
exciting.
is
Really exciting.
so moving,
Yeah.
really moving.
Yeah.
All right. And thanks to everyone watching. And I hope to see you in one of these other videos in this playlist. Bye, everyone.